I like to sing, I like to dance, I like to move. I throw amazing parties. I'm a nature lover. I need to be in the open air, and the place I'm really happy in is in the water. I was born in Sheba, so it was only natural for me to become a doctor. I celebrate life, and I usually remind everybody how beautiful life is. Hello, I'm Dr. Einav Gal-Yam, head of the Breast Oncology Institute. I became an oncologist because of the unique combination of long-term personal patient care and cutting-edge research that this medical profession offers. I've established a research lab studying various aspects of breast cancer and its treatment. For 10 years, I've headed the Oncology Ambulatory Care Department, where we made leap changes in virtually all processes involved in patient care, flow, and chemotherapy treatment. For years, I worked alongside Professor Bella Kaufman, who was my mentor. I've learned so much from her. She was soft-spoken and calm, but she always knew and she achieved what she strived for. When I became head of breast oncology and the integrated breast cancer practice unit, I put an emphasis on a multidisciplinary teamwork, which I believe is one of our major strengths. Today I'm going to speak about the IPU model and its impact on us and our patients.
Please welcome to the stage Dr. Einav Gal-Yam.
Imagine, what if every time you want to know what time it is, you had to combine the cogwheels in your clock so it will work right? It is complicated, time-consuming. You're not even sure how to do it, and you might just get it all wrong. But this is similar to what a patient diagnosed with breast cancer had to go through until recent years. My name is Einav Gal-Yam. I'm a breast cancer oncologist at the Sheba Medical Center. Today, I will tell you how we changed the way we treat our breast cancer patients by working as an integrated practice unit, and how this has impacted their journey and their outcomes. A woman can be diagnosed with breast cancer by various ways. Through a routine screening mammography, because she or her doctor feels a lump in her breast, or rarely because of symptoms of metastatic disease. No matter how the diagnosis was made, patients describe their feeling when they hear that they have cancer as if the sky has fallen down on them. They have met the emperor of all melodies. And this melody is a complex medical situation. It is scary and confusing. There are so many things to be done, so much information to be gathered. It needs surgery, medical oncology treatment, radiation. Sometimes plastic surgery is in place. All pathology details have to be gathered. Radiological exams have to be performed. Sometimes we need to know the genetics, as it may change the treatment course, or for young women who will want to bear children in the future, fertility preservation and a gynecologist consult may be needed. And there are financial and family and psychological issues. Will the patient be able to continue working throughout her treatment? What should she tell her elderly parents, her young children? How? She needs guidance and comforting. So you understand, to achieve the best results, which are cure and preservation of the quality of life, breast cancer needs to be treated by numerous specialist healthcare providers, and the clock is ticking, as time makes a difference. The sooner the cancer gets treated the right way, the better are the results. Previously, the patient would have started her journey by going from one specialist or one silo who referred her to the next one in a linear fashion through various administrative procedures. And while every specialist is excellent, a perfect cogwheel, each one worked separately and spoke a different dialect of the medical language. And so his or her part of the story from their own perspective, similar to those blindfolded people who are describing the elephant differently through touching its different body parts. It impacted the whole journey. Moving from one specialist to the next might have taken too long, or an important exam or procedure could have been missed or performed at the wrong time. The patient did not have enough information on how to navigate the whole process. The machine did not work in an optimized manner. We aim to change this. We transformed our treatment model to that of an integrated practice unit, or in short, IPU. IPUs are defined as those which provide highly coordinated multidisciplinary care centered on a specific medical situation along its entire clinical course, from diagnosis through active treatment through survivorship. This course can span years. How did we evolve into an integrated practice unit? We started years ago. In simple coordination between the various specialties, all of us meet in dedicated weekly multidisciplinary meetings where we discuss each patient's case and together reach a conclusion regarding the best way of action. Should this patient have surgery or medical oncology treatment first? Do we need to gather additional radiological or pathological or genetic information to proceed? Is the intervention of a social worker or psychologist in place? When we sit together in the same room, and for the last 2 years in the same Zoom, we start to talk in a similar language. We can see each other's perspective, and we make much better decisions this way. However, while joint decisions made in the multidisciplinary board are essential, they are useless if they are not executed in a timely and efficient manner. So we cooperated to take this multidisciplinary work a step further. We sit together, representatives of all disciplines, discuss and map the different treatment pathways our joint patients going through, and we define the gaps in these pathways. We measure time intervals of the various processes, the time from surgery to a pathology report, to a meeting with the oncologist, to receiving chemotherapy. We analyze the causes for delays. We ask our patients what they are missing during the treatment course and at what stage. We define which additional healthcare and administrative personnel or technological or digital tools are needed to better fulfill their needs. So, what did we achieve so far? Here are some examples. Practically all of our patients' cases, 100%, are discussed in our tumor boards to reach joint decisions, which are efficiently executed by nurse and administrative coordinators. We implemented digital and administrative tools to improve efficiency. This resulted in reduced timelines of about 30%, while patient numbers and procedures have concomitantly increased. Additionally, it made processes much more transparent to the patient. Each of our patients is proactively contacted by a social worker and, if needed, has access to our in-house genetic counselor, gynecologist, dietitian, psychologist. And we developed information resources and digital tools to aid our patients navigate their journey. One of these is our symptom management application. So, if you're a patient undergoing chemotherapy, you will be sent a weekly digital questionnaire to your smartphone asking about various symptoms that you might have. If you report a symptom above a specified threshold, an alert is raised, and a dedicated nurse will contact you to find out what is happening and to instruct you how to proceed. This kind of management tool has shown to improve patients' quality of life and even survival. And we remember that even when the active treatment is done and everybody is happy, this is not the end of the journey, as many years of survivorship lie ahead. For these, we are implementing various programs dealing with physical, cognitive, and emotional long-term effects of the treatments that we gave our patients. But for me, I believe what made most of the difference is the fact that this process has indeed transformed us to become an integrated unit. We are working and cultivating collaboration. Everyone teaches and everyone learns. And we assume positive intent as a coherent team dedicated towards the same goal. We are bringing extra value for our patients, and we bring extra value for ourselves in the meanwhile. This is us, an excellent team treating breast cancer patients. We have come away, and we still have a way to go. So when you go home today, wherever you work or operate, ask yourselves, what are the measures that you can take to combine the cogwheels around you into a perfect running clock? Thank you.